So as I say, pressure pain threshold normally is the point at which the sensation of pressure switches from being one of comfortable pressure to pain. I used to say slightly unpleasant pain. I found that actually was almost too fine a gradation. We weren't quite sure. Slightly unpleasant, maybe. So I've just gone back to saying, tell me when this changes from pressure to pain. Normally you want to increase the rate of pressure at a fairly constant rate. Okay, so you don't fluctuate, go really fast or really slow. You need to find a rate that allows people time to go, yeah, right there. But if you're going too slow, then you'll find that eventually anything gets painful if you push on it long enough. So you need a consistent rate. 5 newtons per second is normally what we do, and I can show you how you can practice doing that as well using these algometers. Some devices will use a handheld trigger, or sometimes you can have them interact with the computer and the patient can use a mouse. These devices here don't have such a thing, so here we rely on the patient self-report, and I think for clinical applications, that's just fine. Tell me as soon as this becomes painful. Yeah. Normally you would do a minimum of 2 repetitions per site. As I say, usually the first time someone has this done, there's this sort of calibration occurring. That's pressure, is that pain? Not really sure. Oh yeah, that's definitely pain. The second time, more often than not, what I've found is that the second time is actually dramatically lower. And then if I have to do a third time, it usually sort of is midpoint between the first two. Okay. No real reason for going beyond 3, as far as I'm concerned. You could get away with 2 if the first 2 are very similar. And I'll take the time to show this right now. For those of you who have Android devices, if you go to the lab's website, which is pearlresearch.com, there we are. So PEARL stands for Pain and Quality of Life Integrated Research Lab. So you go to pearlresearch.com and go to clinician resources. We've got a bunch of things here for download, and one of them is pressure pain threshold for neck and pressure pain threshold for tibialis anterior interpretation apps. So I programmed these. These are based on a couple of papers that we published a few years back. What they'll do is they'll allow you to put in the actual score. So first you choose whether the person is male or female. You put in your score of the first 2. If the first 2 are within the standard error of measurement of this tool, then it says you don't need to do a third. If the first 2 are outside of standard error, then it says do a third, and it gives you the mean of all 3. And then it will also give you an indication of what quartile the person falls into based on our normative data. So if you go back to your package of clinical tools, I've given you the table. If you take a look at that, so first of all, we've got males and females, because there is a significant and consistent difference. Females do tend to rate lower than males on pain threshold. And that's not just our findings, that's pretty consistent across the board. You'll see that I've given their scores in pounds of force, kilograms of force, or newtons of force. The Wagner instrument, most of these instruments give you the ability to switch between those different units. I am a child of the 70s. I still think of pounds. That's the way I think. Even though we're supposed to be all metric here in Canada, you all know that you go to the grocery store and you still buy things by the pound. So that's just the way I think. So I tend to use pounds of force, but you might choose to use kilograms or newtons or kilopascals is another option. And what I've done there is I've given you the upper limits for each of the different quartiles. And what I mean by that is if we take the entire sample of people who we've tested, and I think when I did that, there was about 300 people in the database. These were all for neck pain, incidentally. We've got a few more than that now, so I'll update the app at some point. But if I took and I plotted the responses of all 300 people, then split that in half, and then split those in half again. We've got the first quartile, second quartile, third, and fourth. Okay. The ones that we're probably most interested in are those that fall down in this first quartile, which would be the most sensitive range. And what I've given you on that table is the upper limit, so that would be this break right there. okay, for the first quartile. And then each one subsequently is the upper limit of the second, upper limit of the third, and everything above the third is the upper of the fourth. Okay. Commonly, when we're looking at people with neck pain, we'll test a local site. Now, I tend to do the angle of the upper trapezius, okay, which is right here, because I've been doing this on a lot of people with acute whiplash or other neck-related problems, and I just feel that it's a bit too irritating to do it right over the facet joints, but I know my colleagues will generally do it right over the C5-6 facet joints. Either way, there doesn't seem to be a dramatic difference in the scores, so I've actually got a database from a number of colleagues now. We've got over 1,000 people in that database, and the scores, I mean, they're different, but they come from Canada, US, Australia, and Denmark. So we've got quite a large swath of people that we're working on right now. And whether it's upper traps or C5-6, there's not a dramatic difference in the scores. Go ahead and when you go and test these things, obviously testing the local site makes sense. So I've got neck pain, I'm going to test sort of over the neck muscles. What do you think is the value of testing over tibialis anterior in that case? I'll do that as well. Is that? As a control area? Yeah, is this person just sensitive or hyposensitive? Yeah. And that's exactly right, and that's why we started doing that, was just to sort of as a bit of a control. But one thing we found is that those who are sensitive in that anatomically distinct region, so in this case tibialis anterior, actually seem to be sort of an important subgroup. There's something happening here. So somebody, let's say, who's been in a car accident, has, you know, whiplash injury, got some neck pain, yeah, I'd expect them to be sensitive in their neck. Not a surprise. But if they're also sensitive tibialis anterior, so if they're also sensitive distally, or in other areas, so Michelle Sterling, for example, from Brisbane, has been looking at other areas like the median nerve and the upper limb tension test and this sort of thing, that we actually have an indication of perhaps of some kind of more centrally facilitated pain experience here. That if somebody's widespread hypersensitivity on this pressure pain threshold, this may be an indication that we're not just dealing with a straight sort of local nociceptive issue here, not just a local sort of inflammation or whatever, but that there's something going on with that sort of central pain processing where they're actually hypersensitive everywhere. And so if you go back to that radar plot that I gave you the very first day, or the very first session this morning, one of the options there was that sort of central facilitated, central neurogenic kind of domain. Widespread sensory hypersensitivity, which we can probably identify, at least in part, through a pressure pain threshold, might be an indication of something central happening, and that should then guide some of your treatment decisions. Right? That might not be someone that you're going to go in and start, say, I don't know, mobilizing or ultrasounding over their neck. It's probably not going to have the desired effect that you want. So that might be someone you have to do something different with. Incidentally, there's all sorts of different resources we've got on this website if anyone's interested. This is a neat one. Physical therapists identify the lingering pain in the clinical setting. We updated the NDI to an NDI 5-item version, so if you ever have the chance and go and poke around the website, please do.